And now, as we were just discussing, the Labour Party is consumed by the contest to choose its next leader and deputy leader. But last summer, it was the leadership race in the Conservative Party that we were all focusing on. And in that contest, Boris Johnson beat Jeremy Hunt to become Prime Minister. Quite a bit's changed since then. Mr Hunt, the former Foreign and Health Secretary, has since become chair of the House of Commons Health Committee. He joins us now in the studio. Thank you very much for being with us.
Morning, Sophie.
Congratulations on the chairmanship.
Thank you.
You want to focus in particular on maternity safety, on the health of babies and mothers as well. What exactly is it that you're so concerned about?
Well, we have about 4 babies dying every single week across the NHS. And this is, by the way, not something that's unique to the NHS. This is something that's the case in healthcare systems across the world. And these are awful, awful tragedies. I don't think anyone can think of something that would be more traumatic. I've got 3 young children myself, and it is literally the worst thing that anyone can go through to see their own child die. But the truth is that what we've never properly cracked is how we learn from those mistakes, how we make sure that when those terrible things go wrong, what tends to happen at the moment is people are worried about lawyers, they're worried about getting sacked, they're worried about the reputation of their hospital and their unit, and these incredibly ethical doctors and nurses who want to do nothing more than be completely open and transparent about what's happened, and if they've made a mistake, say so and make sure the lessons are learned, find the system makes it absolutely impossible for them to do that.
So what can be done then?
We need to
for whistleblowers, is it? Or?
Well, we need to change the culture so that at the moment, in most professions, your profession, my profession, our bosses understand that sometimes we make mistakes. And if you make a very serious mistake, well, you might lose your job. If you are reckless, completely idiotic, then of course you might lose your job. But if it was just the kind of ordinary human mistake that we all make, then you understand that something happens to us all and we learn from it. In medicine, we don't really have that clear division, because when someone dies, it's such a big deal. And so sometimes even the ordinary human mistakes get elevated into something where someone has to lose their job. And if that happens, then of course people aren't going to be open about the mistakes. And medicine is really the only profession where the price of something going badly wrong is often that, sadly, you have these tragedies, and that's what we have to change. It's
interesting how you seem to be painting a picture where relatively small human mistakes can lead to these kind of devastating consequences. And it does feel to me like, you know, we often talk about the kind of big scandals in the NHS, but if you're thinking about women giving birth in hospital, the kind of aftercare you receive, these small mistakes, small problems seem to be almost commonplace, almost accepted, that you might not see the same midwife, that, you know, your postnatal care may not be what you're expecting for, that people weren't communicating with you during the birth process. I mean, why are we getting these things so wrong?
Well, I think it's important to say that the vast majority of NHS care is totally safe. In fact, the Commonwealth Fund said that we are the safest healthcare system in the world, but we're also the most transparent healthcare system in the world. We care passionately about our NHS. It's the #1 issue. I see it's now overtaken Brexit as the issue that's most of concern to the public. And I think this is something the NHS could blaze a trail on. But if we're going to do that, we have to recognise that when those human mistakes are made, we have to allow doctors and nurses the space to learn from those mistakes. And the right reaction, it's easy to scapegoat someone, but actually the right reaction is to understand why the mistake happened and then to design a system so that it can't happen again.
It's interesting listening to you because, of course, you're not someone who is just an observer of the health system. I mean, you were Health Secretary from 2012 to 2018. So some of our viewers might be thinking, oh, it sounds great that you're calling for all these changes, but why on earth didn't you do it when you were Health Secretary?
Well, I did make a number of changes, and I'm incredibly proud as to the way the NHS has reacted since we had the tragedies of Mid-Staffs and Morecambe Bay. And I don't think there's any doubt that we are much, much more transparent about things when they go wrong. So if you look at Mid-Staffs, for example, that happened over a 4-year period. That was really the shocking thing about it. It took so long for something to happen. And now we have the new CQC system. We've had 40 hospitals put into special measures. So there's transparency now when things go wrong at a hospital level. But I still think when it comes to what happens for an individual doctor and nurse, we need to do much more to support clinicians on the front line so they can be open and we can turn the NHS into this giant learning organisation, which is what it really needs to be.
OK, we've been talking about health. You, of course, were former Health Secretary. You're also the former Foreign Secretary. Recently, we've seen some really horrific scenes happening in Idlib, in Syria. Families dying, children dying, war crimes being committed with the use of barrel bombs, with hospitals being targeted. Why has the international community failed so comprehensively with Syria? And is this something that we should feel a sense of shame over?
Well, first of all, I'm very grateful that you have raised this issue, because it seems to me with coronavirus and with all the other issues going on around the world, this is like the forgotten tragedy that's happening at the moment. And it is an absolutely appalling human tragedy. And remember how much people in Idlib have already been suffering for the last few years. The reason is because Western foreign policy to Syria has been inconsistent. One moment we are fighting Assad, we're saying we're going to remove him, we're saying that Syria has no future with Assad at the helm. The next moment we're saying we're out of here, we don't want anything to do with it. And whilst we have that inconsistency, then I'm afraid the potential for these tragedies to go on and on increases.
What do you make of the current policy on it?
Well, I understand why it is that Western public opinion wants to disengage with the Middle East. It's a long way away. We see these terrible tragedies of our own soldiers being killed in Iraq and Afghanistan. But in truth, we are always going to have some presence in the Middle East. It's absolutely essential to our national interests. Britain is one of the most engaged countries of Europe in the Middle East. And I personally thought it was a great shame when we abandoned the Kurds, who have been fighting alongside us for very many years. So I think it's really about consistency, about recognising that when you have destabilising activity by countries like Iran, if we blow hot and cold on these things, then that gives them the opportunity to run rings around us.
Do you think, is this one of the things where you look back and you think, I wish I'd done a bit more when I was Foreign Secretary?
Well, I think Britain, and I don't take credit for this myself because it was a joint effort, but Britain did a great deal. I mean, we were one of the countries, for example, that organised the evacuation of the white helmets from Syria. That happened in my first month as Foreign Secretary, and we made an absolutely decisive intervention that got them taken out of Syria. We are
not making that many decisive interventions now.
Well, I hope that Brexit will be a moment when we can start focusing more on the outside world, because one of the things that's perhaps my biggest surprise as Foreign Secretary was when you go around the world, all these different countries, other countries have a whole lot more respect for Britain than we sometimes seem to have for ourselves, and they want us to be involved in the world.
Interesting. Now, I want to ask you about another case, the case of Anne Sakoulis, who is the driver, the American driver, who is wanted in the UK over the death of Harry Dunn, the teenage boy who died very sadly. Now, she fled to the US, claiming diplomatic immunity. It's since emerged, and Sky News has confirmed that she's a former CIA operative. Now, at the time, she wasn't at the time of the death, it's important to say. Do you think that has any bearing on why the US has been refusing to extradite her?
Well, it may have a bearing on it. And, I don't know the truth of these things because I'm not Foreign Secretary anymore. But I still think it is totally and utterly unacceptable that she is not facing justice in the UK. And if anyone is questioning that, I think we just need to ask what would have happened if the boot had been on the other foot, if a British diplomat had been involved in a road accident in the United States where someone had died and had fled on a private plane back to the UK and was evading justice. I don't think President Trump would stand for that for 1 second, and I don't think Britain would have behaved in that way. And I would just say to the United States, I'm someone who is the strongest supporter of the special relationship. I think in a very uncertain world, the democracies of the world need to stand together. But if we're going to be an alliance, we need to treat each other like allies, and that is not happening.
So you think the US is not treating us as an ally over this case?
And I think they should send Anne Sakoulis back. We are, alongside America, the country that has done the most to stand up for the rule of law across the world. And we need to show an example in cases like this.
OK. Now, we're expecting a reshuffle next week. If Boris Johnson picked up the phone to you offered you a cabinet job, would you go back?
Do you know, Sophie, I am so relieved. This is the first reshuffle that there's been for a decade where I haven't had to wait by my phone and think about my future. If you may remember, I was involved in a famous reshuffle in 2018 where Theresa May wanted to move me from my job as Health Secretary in the middle of an NHS winter crisis, and I said I wasn't prepared to go.
You've got a bit of a reputation, haven't you, about being a difficult customer when it comes to reshuffles, because you refused Boris Johnson's job after last time as well, didn't you?
Well, there are often very specific reasons, but I actually think Boris has made an excellent start as Prime Minister. I want him to be successful. I don't rule out in the future, but somewhere away, serving him because I want him to be a success. But during that leadership campaign, I realised that I had been in the cabinet for every hour that my 3 kids have been alive, because I've been in the cabinet for 9 years and my oldest is 9. And I thought this is a period to have a bit more time for my kids, a bit more time for my constituency. I've also been very long suffering, so I shall be very happily not waiting by the phone this time.
So you've been a better dad as a result, you think?
Well, you have to ask my kids about that, but at least I've been giving them more time.
And of course, you famously ran against Boris Johnson to be leader of the Conservative Party and Prime Minister. Is there anything you'd have done differently if it was you in number 10 now?
Of course, we're different people. There are lots of things that I would have done differently.
So, for example?
But one thing that I hope would have been exactly the same is that I am a strong supporter of HS2, and I very much hope, in fact, I would go for HS3, HS4. As someone who lived in Japan, I've always been ashamed at the state of our railways, and frankly, nearly anywhere else you go in the world, they have decent railways which have had proper investment. And if we want to be a modern 21st century country, then it's time we sorted that out. So I very much hope we go full speed ahead on that one.
OK, well, not long to find out if we do. Jeremy Hunt, thank you very much for being on the programme this morning.
Thank you, Sophie.